Hi, Mr. Jones. I wanted to talk with you about the pathophysiology of three types of hypertension: primary hypertension, secondary hypertension, and complicated hypertension. Primary hypertension is also known as essential hypertension. It's when the pressure of the heart as it pumps blood into the arteries is greater than 130, and the pressure of the heart when it relaxes and fills with blood is greater than 80. Increased sodium intake increases blood volume and therefore makes a tight space for blood to travel. Stress makes blood traveling in tighter spaces and higher volumes a situation for reduced blood flow and increased resistance, this resulting in hypertension. Secondary hypertension is high blood pressure that's caused by something else rather than a chronic state of its own. Pressure in the arteries is determined by the blood pumped out and the blood vessels accommodating to that volume. High volume and high demand for volume accommodation creates pressure and resistance. For example, hormonal and kidney disorders can alter blood vessel flexibility to accommodate for high volume and therefore result in secondary hypertension. Complicated hypertension is known as a hypertensive emergency. It's when blood pressure increases very quickly in a short amount of time. Decreased flexibility to accommodate high blood volume will increase resistance. This, along with constricted blood vessels, will also inhibit adequate blood supply to the organs. This would result in end organ damage. And Mr. Jones, I noticed the data in your history. There's most clinically significant information related to hypertension in your history. I would want to address the lack of exercise, the shortness of breath with exertion, like climbing the stairs, limited exercise, and beer every night, and not keeping an eye on how much carbs, fatty foods, or sodium intake. That places you at risk for having a heart attack. And your mother having a history of type 2 diabetes, those eating habits would also place you at risk for diabetes as well. And should you have a heart attack, that would also be a high risk for a poor prognosis. More poor if you were not to have diabetes. Sustained complicated primary hypertension, a pathologic effect of that would be fibrinoid necrosis of vessels, which means cell death to your blood vessels. The pathophysiology with this is inadequate blood supply due to constricted blood vessels that will not have a supply of nutrients or use for the blood vessels. Lack of nutrients causes cell death and result in dead blood vessels. A way to improve your self-care and avoid some of these complications: I noticed that you are a police officer, so I imagine you being in a very stressful environment. Some relaxation techniques while you're at work or after work would be beneficial in alleviating stress and promote vasodilation, which means an opening of your blood vessels or expanding of the blood vessels rather than constricting them. Exercise would be healthy stress, and incorporating a healthier diet, like adding fruits and vegetables, decreasing carbs, fatty foods, and monitoring your sodium intake, and along with decreasing your alcohol consumption, would greatly improve your self-care in avoiding those complications.